morning, like 60 Minutes. Who are you? Down there. Do you have a girl closet? She asked him that a couple of seconds ago.
I did. I asked him if he has a girl
How many
closet.
suits do you own? Do you have 1,000 pair of shoes? Do you have a girl closet? I said, he's a doctor. He wore scrubs for so long. Now he has to wear a suit every day.
Oh, my.
And I said, I've got a bunch of suits, but I enjoy wearing them because maybe I wear a suit 5 times a year. Mm-hmm. You've got to put something like that on every day. I would bet if you have your way, you would never put a suit on again.
So at some place, where was I? And everybody was wearing Hawaii shirts. It wasn't Hawaii. It was like, someplace here in Louisiana. Doesn't that sound kind of great?
Yeah, that does.
Awesome. I think I should be able to turn on C-SPAN some afternoon and see the United States Senate in session wearing nothing but Jimmy Buffett clothing. I think that would be an awesome
I love that. You were here last night, yesterday, for a big event CADA sponsored with regard to the opioid crisis and other drug issues that are, kind of become a plague across the country. I understand you did a lot of listening, and I'm curious what you heard. Did you hear anything that's going to help?
Absolutely. A couple things. First, it's this incredibly compelling story. This woman who had her first drink her mother was an alcoholic. She had her first drink of alcohol at age 9. First methamphetamines at age 12, which a relative gave her. And she was just in this pathway. She said, I was just inherited addiction. And she's in this pathway to self-destruction, has a child, and after having the child wants to make a change. Goes to CADA and is given the tools, and now she's been in recovery for years.
Tell us what that is, by the way, CADA. You would know.
Council on Alcoholism and Drug Abuse.
Thank you very much.
Mm-hmm.
And then one of the board members stops me on the way out, a younger man, an attorney. He says, I was an alcoholic, and my parents did an intervention and rescued me from my alcoholism, and now I am, he didn't have to tell me, I knew he's a successful attorney. So a real story of hope. Shout out to Sheriff Whittington. Sheriff Whittington is working with the Department of Corrections. If they arrest somebody on drug charges, they differentiate between a hardened criminal and someone just getting started. They try and divert the one getting started so that their life can be whole as opposed to mixing them with a hardened criminal.
Is the medical profession talking opioids here, painkillers, etc., especially prescription stuff? Is the medical profession nationwide just coming sort of an awakening, if you will, as to the dangers of the collateral damage that they're doing? Has that been something that's been discussed in the medical field for a long time? Because I've known people who have been on painkillers for like 2 days, and I know that the prescriptions that doctors pass out now are like, okay, I'm going to give you 3 of these, and you will never get any more from me than that because they're so addictive, right?
Totally, and I can say, because there's some people who are genetically predisposed to becoming addicts, and so you give them a 2-week supply, they end up as an addict. There is increasing conversations among dentists, physicians, and other prescribers as to how to limit that. And we've been very proactive in Louisiana. Dentist medicine have all tried to educate their members to decrease the number of opioids being prescribed, if you have to prescribe at all, and then helping law enforcement round up those few bad actors.
That troubles me a little bit, because I think as a person who's, middle of my life, I think if something were to happen to me, hush up down there.
That wasn't me.
I'll throw something at you. If I were to need a prescription, I'm worried that I won't be given opioids or whatever it would be because of and I'm not going to be the person that becomes addicted. It's just not in my nature. But that I won't get the right drugs because of the concern about the addicted folks. You follow me?
A couple things about that. First, my daughter recently had oral surgery, and the doctor gave her a prescription for opioids. But I'm a doc. I said, you don't need these, so I put her on Tylenol, maximum strength, several times a day, and in between gave her Motrin, maximum strength, several times a day. She was totally pain-free, as much as you can be, but as much as she would have been without opioids, never took an opioid. So one thing, we don't have to immediately go to opioids. There's a lot of other things that we can do to avoid. That said, the people are still allowed to give these medications, just not as many per dose, with more care to make sure folks aren't addicted.
Is there pressure on physicians by big pharma, by the companies that make those pills? Is there pressure on the medical profession to prescribe those a little more freely?
The opioids?
Yes.
So what clearly had happened is that Purdue Pharmaceuticals began to promote opioids in a way which in retrospect was not a good thing. And there was a sense that giving opioids was benign. As it turns out, it's not benign. People did become addicts and having an incredible number of problems. Purdue is being investigated as to whether or not what they did was illegal, certainly unethical. I can't say that it was, but they're being investigated and even sued regarding this.
What can Congress realistically do to help solve this? What are you working on?
Congress has made a lot of money available for states and local communities to put in programs. But unless there's local leadership, nothing happens. That's why it was so great to go to that CATA program yesterday and to hear from the folks there, to hear from Sheriff Whittington, Department of Corrections. There is local leadership here. There is local leadership, which means that there can be hope. I'm also doing other things. What can you do to make sure that if we're putting money into a program, that it's accountable for good results? Not just a way to earn income for the director of the program. We've got to be wise with how we spend taxpayer money.
You had, as I recall, and I know you'll correct me if I'm wrong, you took a rather controversial stand, I think, during the campaign when you said that you were in favor of medical marijuana, right?
Yeah, right.
And that has come to pass in Louisiana. I know you think it's a good idea. Tell folks why, and at the same time, why you think it has to be and will be so tightly controlled.
Well, so one, marijuana just is pervading our society. I'm a physician, and I would always ask my patients, do you smoke marijuana? Oftentimes they would. And how hard is it to get? Not hard at all. And so one, it just seemed to be out there. But then there's some folks who it would really benefit. I was treating hepatitis C. The medication you gave caused nausea and would make people lose weight. So just as for chemotherapy, people would take marijuana in a way that would help their appetite increase and help their nausea decrease. So I saw that there was a medicinal effect. A woman on chemotherapy, I know, the only thing controlling her nausea was the marijuana. Now, that's not to say that you need to be selling joints on the sidewalk. Not saying that at all. But if there's a patient with a legitimate need, it seems reasonable that she should be able to get it. Also reasonable that we do research, that we find, just what is true and what is not true. If it's not true, it shouldn't be promoted. But if it can help someone like these patients on chemo, well, then I'm okay with that.
Let me ask you this. I know you don't sit on the sidelines and watch, but you're no longer as active as you used to be. The safety net hospital crisis in Louisiana, you have to have an opinion about what's going on.
So we need a healthcare system which is access for everyone to have healthcare, but which is sustainable for the for the taxpayer. We have a budget right now in our state which is obviously running a deficit, and so as a result, the LSU hospitals are bearing the brunt of the tax cuts. Now it's kind of crazy. I was just looking at statistics on the way over here. On a per capita basis, Louisiana state government gets more money in taxes than Texas does, than Alabama, Florida, or Georgia, South Carolina. There's more money coming into this state not from the federal government, but from the state tax base than those states.
Wow.
Now, you can't help but notice, you go to Houston, they're building more interstate in Houston and Harris County than we're building in the entire state of Louisiana. So we're not spending our money wisely. We have to be able to support those hospitals, but we have to spend the money we have wisely. Taxpayers are giving that money to the state government. You have to treat it like it's your own.
What you up to the rest of the day? Headed back to D.C.? What's the plan?
No, we've got a couple more stops here in Shreveport, then we go back to Baton Rouge. We've been working the state all week in New Orleans, Livingston Parish, North Shore, Lafayette. It's been a great week.
Wonderful. Well, let me know if you need a bigger closet or more shoes. I'll be happy to help you.
Girl closet, you got to define that for me.
Erin's has her own zip code.